Primary hemostasis encompasses the critical processes of vascular constriction and the formation of a platelet plug. This initial stage is vital for the effective control of bleeding, anchoring the body's response to vascular injuries. Transitioning to secondary hemostasis, this phase is marked by the intricate interplay of coagulation and anticoagulation systems. These systems collaboratively function to reinforce the platelet plug, thereby ensuring the formation of a stable and effective clot. Coagulation factors are essential constituents of the hemostatic response, playing a pivotal role in both the initiation and propagation of clot formation. An in-depth understanding of these factors is crucial for the accurate diagnosis and management of coagulation disorders. Plasmin plays a critical role in the degradation of fibrin, a key component in the clotting process. This regulation is essential to modulate blood clotting and prevent the formation of excessive clots, an intricate balance maintained through various activators and inhibitors. In the context of coagulation, factors such as calcium ions and antihemophilic globulins are indispensable in the activation of the coagulation cascade. Their contributions significantly influence the body's physiological response to vascular injuries. Hemostasis disorders, which include both thrombophilic and hemorrhagic conditions, may arise from congenital or acquired disturbances within the hemostatic system. Such anomalies can pose serious health risks, necessitating a comprehensive understanding of their underlying mechanisms. Hyperpronemia, defined by elevated protein concentrations in the blood, can be associated with various cardiac conditions and may stem from genetic mutations. This complexity further complicates the landscape of treatment options available to affected individuals. Moreover, slow blood flow and heightened blood viscosity serve as significant contributors to the emergence of cardiovascular syndromes. These physiological changes can culminate in severe complications, such as thrombosis and ischemia, which demand careful clinical attention. Antiphospholipid syndrome represents another critical area of concern, as it can precipitate dangerous thrombotic events, including deep vein thrombosis and pulmonary embolism. Increasing awareness of these potential risks is integral to facilitating timely and effective interventions. Disorders such as thrombocytopenia arise from increased platelet consumption or destruction, complicating the clinical picture associated with vascular dysfunction. Recognizing these conditions is essential for accurate patient assessment and management. Purpura often serves as a visible manifestation of underlying vascular issues, particularly in women. Identifying the root causes of purpura can significantly enhance the diagnostic process for systemic health conditions. Patients may exhibit symptoms of vascular dysfunction such as spontaneous bleeding and the development of hematomas. These clinical manifestations underscore the critical importance of monitoring platelet levels to ensure patient safety and optimal care. Infections can also precipitate thrombocytopenia by eliciting an immune response that results in both platelet destruction and diminished production. Timely identification of such infections is crucial for effective management strategies. Furthermore, drug interactions, particularly with certain medications, can induce thrombocytopenia via mechanisms such as immune-mediated destruction of platelets. It is vital for healthcare providers to remain vigilant regarding these interactions to ensure patient safety. Additionally, genetic predispositions may render individuals susceptible to disorders that lead to thrombocytopenia. A comprehensive understanding of these genetic factors can facilitate the development of targeted and effective treatment strategies. The influence of anti-inflammatory drugs, notably aspirin, is significant as they modulate metabolic pathways associated with bleeding disorders. Their pharmacological action directly impacts the synthesis of enzymes essential for hemostasis. Metabolic disturbances arising from granule syndromes can lead to notable bleeding complications, particularly following surgical interventions, due to acute mucosal erosion. The severity of these conditions can pose life-threatening risks. These hereditary syndromes typically manifest in specific symptoms such as hemarthrosis and easy bruising, with genetic influences playing a substantial role in their presentation. Such evaluations are critical for appropriate patient management. Common symptoms of hemophilia include spontaneous bleeding episodes, notably into muscles and joints. Interestingly, these symptoms may not manifest until later in childhood, complicating early diagnosis. The diagnosis of hemophilia often relies on a detailed family history and specific blood tests designed to assess bleeding time and clotting factor levels. This thorough evaluation is essential to ascertain the severity of the condition. Management strategies for hemophilia include the avoidance of certain medications, particularly aspirin, which can exacerbate bleeding tendencies. Treatment plans often incorporate infusions of clotting factor concentrates to help mitigate bleeding risks.